I'm Jason West from the University of North Carolina. For the past several years, I've been honored to have been part of the HAQAST team, and we're excited today to share what we've accomplished over the past 4 years. These are the projects that we've worked on, and I've been lucky enough to have been part of 3 Tiger Team projects. We won't talk about everything today, but I'll choose these projects to talk about. First, we'll talk about our work to map pollutant concentrations associated with the California wildfires in 2017. Secondly, we'll talk about one of our core projects to map global surface ozone concentrations through a data fusion of measurements and models. And this was in support of the global burden of disease assessments. And third, I'll share some results from our Tiger Team projects to look at the effects of changes in air pollution related deaths in the United States since 1990. Okay, let's jump into it. Our wildfire work was part of the Tiger Team led by Susan O'Neill and Minghui Diao. We had done this project to do data fusion, and that was led at UNC by Stephanie Cleland. And we also worked with my colleague, Mark Sayre, and I'll describe his input here as well. This project was in collaboration with the Bay Area Air Quality Management District. The general problem that we have is that we get information about concentrations from different sources, and each of those sources has strengths and weaknesses. So monitoring stations are obviously highly accurate, but they provide information at a point location that doesn't necessarily provide good information about the surrounding area. A model will provide complete space-time coverage, but of course the model is inaccurate. And if we look at satellite data as well, that has good spatial coverage, but we're limited in time to 1 daily overpass, and the satellite as well is inaccurate when we translate what the satellite retrieves to ground concentrations. So the method that we're going to use in this project and the next one that I'll talk about was developed over many years by my colleague Mark Sayre. It's called the Bayesian Maximum Entropy Framework, and I'll describe that here. We're basically trying to come up with best estimates for what concentrations are at all points in space and time, given information from measurements, shown in black here, and a model that's shown in green. With the measurements, we can create what we'll call here a mean trend. The model has, or we could say satellites as well, have uncertainty around it. The BME method creates a smooth function through this so that it matches the observation perfectly at the observation location. The influence of that observation falls off with space and through time as a function of the spatial and temporal covariance. Where the model or satellite is very uncertain here, the BME estimate will tend toward the mean trend. Where the uncertainty in the model or the satellite is low, it's going to tend toward that model or satellite estimate. We're also using another related method here known as the CAMP analysis. This is a nonlinear way of bias correcting, and we're applying that to CMAC and the satellite observations. Okay. This then shows our results day by day, estimates of PM 2.5 over California. You can see the first several days of this loop were the most polluted. The highest PM 2.5 that we estimated was greater than 190 micrograms per cubic meter. We estimated that about 60,000 people were exposed to very unhealthy levels in EPA's eyes of PM 2.5. And then if we look at the daily average standard from EPA, that was violated because of this fire for 15 million people. So really a large event that exposed a large population to it. So our conclusions for this work, we saw that fires had a clear impact on air quality, reaching PM 2.5 levels that are dangerous for health. We applied here several different BME space-time kriging and data fusion methods and found that all 4 of those different methods perform better than the model or the satellite-derived PM 2.5 itself. That is, then when we take information from different sources and combine them together, we're better off than using one source by itself. We found that fusing observations with CMAQ provides the best overall PM 2.5 estimate. When we combined it also with satellite, we found a little bit less good performance, a little bit poorer performance. And we saw that when we used temporary station data, that improved the PM 2.5 estimates. So those are temporary monitors that were put out to observe the fire, and those were helpful in understanding the whole shape of the plume, et cetera. I'll mention that Stephanie is continuing this work by doing a health impact assessment, given our estimates of PM 2.5 levels that people were exposed to. Great. The next project I'll talk about is where we mapped global surface ozone concentrations. This is again through a data fusion of global ozone observations. And here we're using an ensemble of many different global models. Our stakeholders here that we worked to inform were with the global burden of disease assessment. And the team that we had to work on it were Marissa DeLange and Jacob Becker, along with Mark Serra and me at UNC. And we worked with Owen Cooper and Kailan Chang, who are with the University of Colorado and NOAA. But really, there's a big team of people involved in putting together observations in what's known as the Tropospheric Ozone Assessment Report. This is the largest ever compilation of ozone measurements that's been made. And we worked with a lot of, with the output of several different models. Many of those models came from the Chemistry Climate Model Initiative. Okay, so our first pass at this was to support the Global Burden of Disease 2017 assessment. We used ozone observations, and those are shown here. We used CCMI models. This is the multi-model mean. If you just look at that with respect to the observations, you'll see that the models are biased high, and we want to correct for that bias in our final product. So in putting this together, this was Kailan Chang's real innovation here. Rather than using a simple multi-model average, he came up with a method of using for each world region, so North America, Europe, East Asia, et cetera, using, he created a method whereby we could find the linear combination of models that best represents the observations, and then use that linear combination, bias correct it, to give us estimates in all over that region. And of course, we'll use a different set of models in different world regions. And this was then the product that we created. This is the 2008 to 2014 average of this ozone indicator that is useful for estimating health impacts. Global burden of disease then took our results, and using that estimated here that 470,000 or so people die prematurely each year globally to exposure to ozone. We've continued to work on that to deliver new results in support of the GBD 2019 assessment. Now we're estimating ozone every year from 1990 to 2017. We're using additional models. We're using 9 models now, and more observations. This shows the full suite of observations we have, including a bunch of new observations from China, which is a very important region. We're using BME data fusion, as I described before, to do a smooth weighting of observations across space and across time as well, so that we're influencing using observations in one year to influence other years where there's not observations. So this becomes important where new observation data sets are added through time. And we're using a NASA model that was around a very fine spatial resolution to impose a fine spatial structure, especially around urban areas, but really globally, to the results that we'll create. Okay, to illustrate our method, so I'll show you results just for 1 year here. This is 2015. These are the observations. We have very good observational coverage in parts of the world, but really not in some other areas, obviously. This is the multi-model composite that's bias corrected using Kailan Chang's method. Now we're using BME to correct this map. and we come up with this space-time estimate for 2015. If we take the difference between these two, that's shown here, and you can see that we're adjusting up here in some parts of China, for example, close to observations, adjusting down in some other regions such as India here. Okay. We were really very pleased with how this, our methods worked. So if we look at the multi-model mean here, there's a big error, a low R squared. The multi-model composite reduces that bias. When we do our space-time BME data fusion, we get a very good R squared of 0.81, and the error has gone down quite a lot. And when we go to a fine resolution output, we degrade the performance a little bit, but that's to be expected because we no longer force the model to agree with the point measurement at every place. Okay, so this will cycle through the years, showing our output. Our BME ozone estimates match observations at monitoring stations. The influence of those observations drop off through space and time according to the covariance. And away from observations, the output that we create is the multi-model composite. Our estimates here were used, delivered to GBD, and are being used for GBD 2019 to estimate global ozone mortality. That will be published later this year. And once it's published, our data will be shown on the State of Global Air website. This is another look at our results. So this shows up here the percent of the population each year that is exposed to different levels of ozone. And you see that overall, the global population is through time being exposed to higher ozone concentrations. Down here, we're looking at trends by world region. Here's North America decreasing. But the big story here is that global ozone exposure is going up, driven by high ozone in South Central Asia, which includes India, East Asia, which includes China, as well as an upward trend in Africa. Okay. The last study that I'll talk about today is our work to, as part of a Tiger team that I led together with Brian Duncan, to estimate the health benefits of decreases in PM2.5 and ozone in the United States as air quality has improved over the past few decades. In doing this, we're using a few different data sets. One is, a unique 21-year simulation of CMAQ that the EPA conducted. We're also using the North America chemical reanalysis that essentially extends that EPA data set. And we're as well using satellite-derived PM2.5 estimates. I should say we're doing this for both PM2.5 and ozone, but the satellite product, which is what is shown in the movie, is only for PM2.5. One of the innovations here is that we're using annual county level population and baseline cause-specific mortality rates from the CDC to assess air pollution mortality in each year. And you'll see in a minute what we're able to do with that. Okay, so US PM2.5 related deaths are estimated here to be going down. We did this for ozone as well, but I won't show you those results in the interest of time. And when you look over the years here where these different data sets coincide, you'll see that there's scatter among the results using different data sets. But one of the big important points here is that all of these three data sets show that PM2.5 related deaths are going down through time pretty starkly. So if we look at that EPA data set, that's a drop of about a half of the estimated deaths over this 21-year period. Just looking at the EPA data set, and we can do this for the other ones as well, we can take that and tease apart the influence of, the importance of different influence on the overall PM2.5. So this is the overall trend showing PM2.5 related deaths decreasing through time. This is the change, the blue curve, when we only look at the effect of changes in concentration, holding essentially the population constant. The red curve is if we only change population factors, that is the baseline mortality rate, the population getting less susceptible to air pollution through time, despite the fact that population is growing, and holding concentration constant. When we look at that, we would see that PM2.5 related deaths would have gone down slightly anyways, but really the big story here is the effect of PM 2.5. And we've singled out this effect of PM 2.5 reduction since 1990, which we estimate to have decreased deaths in 2010 by about 36,000 deaths per year in 2010. Great. So thank you for your attention. I was really happy to be able to share these exciting results with you today. And I want to make sure to give credit where credit is due to our great students and collaborators. And I wanted to call attention these students who created posters for the HAQAST meeting. And I hope you'll take time to visit those. So thank you very much.